Well, hello everybody, and welcome again to the 2014 Endurance Summit Series. And this is Manny Aragon from the Rolf Workshop Center for Structural Performance hosting today. Today we've got another great panelist, Dr. Vince DiSaia, owner of Momentum Sports Therapy. Vince is a really neat center. I've been down there. I went down there actually for a running form clinic and met both Dr. DiSaia and some of his staff as well. I really like the clinic, so it's in a great location. But today we're going to talk a little bit more about where he comes from, what he's all about, with the system that he's put together, and the different tools that he uses to help athletes, endurance athletes specifically, keep themselves together, but also get better performance out of their bodies. So a little bit about Dr. Vince, and correct me, Dr. Vince, if I should call you Dr. DiSaia or Dr. Vince. It varies from doctor to doctor. Okay. So anyway, his background is in both in chiropractic and as a certified strength and conditioning specialist. So he's really got a handle on biomechanics and strengthening of the body for sports specifically. He is a graduate of Southern California University of Health Sciences, and also for looks like both strength and conditioning and for chiropractic. Additionally, he has trained in as an expert in active release therapy, which we're going to talk a little bit about today, the gold standard for soft tissue therapy. Dr. DiSaia is also highly trained in functional movement patterns and kinesiotaping procedures. He uses this combination along with his fitness background to assess, treat, and rehabilitate the entire patient for optimal results. Dr. DiSaia specializes in the treatment of athletes and is a leader in his field. His expertise in sports-related performance and recovery has led athletes of many different backgrounds to seek his counsel. Dr. DiSaia's training in movement analysis and functional patterns allow him to provide each patient not only with a specific detailed diagnosis, but also an explanation of the primary cause. And you know what? That's key. For athletes especially, that's key, because if you're training in your injury, you'll just keep doing it unless it's identified and you're taught how to change that pattern. So awesome that you're doing that. This facilitates the quickest path to recovery and ability for many athletes to continue training and competing during treatment programs. And again, that I want to emphasize that is key, because so many doctors tell you to stop training, and that's the antithesis of what an athlete wants to do. So this is a guy who's on your side. Years of clinical experience with countless athletes has led Dr. DiSaia to create Momentum's optimal performance pathway. The pathway explains how all patients and clients at Momentum Sports are assessed and progress to achieve excellent and athletic performance. So Dr. DiSaia enjoys sharing his knowledge with his colleagues and has previously lectured for doctors, therapists, and strength coaches in topics including low back pain, running injuries, golf swing biomechanics, and golf fitness, which seems to be a pretty interesting field, and I'm sure we'll get into that a bit, although the endurance athletes out there are going to wonder why golf biomechanics matters to them, but I can guarantee you that it does. He's also authored a highly successful book named Golf Anatomy and sold over 30,000 copies worldwide. It's available in over 13 languages and is featured in Golf Digest. So currently the clinic director and chiropractor at Momentum Sports Therapy, Dr. DiSaia's goal is to provide all clients with the best health and fitness services in Orange County to ensure that everyone achieves their goals quickly and effectively. Wow. That was a mouthful. So, but let's get into a little more of the nitty gritty. You've been working with athletes for many years, and you put together a system for assessing and treating the whole athlete. Can you maybe talk about how that came together and how all the little parts fit together, and what's the philosophy behind that?
Yeah, no, sure. First of all, thanks for having me, Manny. It's great to talk about all this stuff. It's fun for me. Yeah, basically, I started off, my background's, I was a strength and conditioning specialist before chiro school. So I first got into that just to understand fitness and biomechanics and how the body works. But chiropractic's really my main background. And I got into that because I just kind of believe that the nervous system and the joint system was so important. And not only overall health, having a good nervous system function, but just joint function is huge. If the joints aren't doing what they're supposed to, it's really hard for the muscles to stay in line. So started off in the chiropractic and got into that. And before I even went to chiro school, I knew I wanted to get into ART because I automatically knew that the muscular system was just as important. So I needed something to address that. And active release technique was really, I found to be the best and what I learned from a lot of my colleagues. So I got into the ART right away, and that became a really powerful tool to assess both joint and nervous system as well as muscular system. And I did that for a few years, and I actually used to train. In the beginning of my career, I used to actually train and treat my clients. So my athletes, I would treat them, and then I'd take them out and write their programs and actually train them. But I kind of found over the years that, I'd get these people to a position where I thought they were healthy, and I was just missing something. They'd go out there, and something else would happen, and it was kind of that movement piece that I knew I needed to address. So it kind of morphed into this, why I created Momentum was really to have a facility where we could look at all the pieces, and the movement part is extremely important because there's only so much I can see in my office clinically. If we don't fix the movement patterns or we don't fix the things they're doing out in their sport or their everyday life, these problems are going to come back. So to really, came across these things in order to assess every part of the picture. So you're not only fixing the injury and the root cause and making sure the joints and the nerves are working correctly, but you're also optimizing their movement patterns so that when they're out there training, they're not putting over too much stress in certain areas of their bodies and having just, reoccurring injuries over and over and over and over. So, this has really become really effective. We get to see all pieces of it and address all pieces of it. Now all of our patients just kind of go through it all. We don't really do it piecemeal anymore. They all kind of have to go through it all and use our whole system. Otherwise they don't get as healthy as they can possibly be, and they don't perform as well as they could. So, that's kind of the three pieces I use: ART, the chiro, and then the functional stuff. And I have a guy here who does our fitness. He's our fitness trainer, Dave Saia, and he's phenomenal. So he helps me with that piece and really has become really good at nailing that stuff down. So we work as a team here. It's not just me. I don't know everything. And I think that's important because more eyes see more things. So we've really been able to narrow down things and communicate with our patients, between each other about clients and patients, and that helps a ton.
Yeah, and I think that's what you said about having all the different elements is really key. I know in my practice, the movement work kind of came in after a time as well. It was like maybe 10 years
Right.
or 12 years after I started, the movement work just started. It just became a no-brainer, and it just started evolving. In fact, it was after I met Chris Kusoff and I was exposed to Egoscue that really kind of, it was that little spark that went, wow, you can do something and get an immediate result and feel it in your body. Wow. And it's kind of like created that spark. So yeah, I really like what you're doing. That's totally cool. So can you explain a little bit more about the system? Like what is the system that you use, and how, what the Momentum system that you've created? Can you talk a little bit about that?
Yeah, sure. I mean, we created a system. I call it the optimal performance pathway, and it's really kind of how we assess people and then kind of the process that they go through. So, like I said, we basically use three major assessments, I guess you'd say. One is a medical assessment, kind of from the chiropractic standpoint, joint function, nervous system, orthopedic testing, that type of stuff. Another one is postural, like you're talking Egoscue. Posture is really important, not only to avoid injury, but really to create as much power as you can. You have to have an optimal posture that you can derive power from. So that's kind of the second piece. And the third piece is the functional piece, it's the movement piece, and that's watching people move, seeing symmetry side to side, strength, weaknesses, and so all of our clients or patients get assessed in all those ways when they first come in. And so we can really see, is this somebody who's, not so much, there's not so many medical things going on, but they got more of a postural functional piece. And that's kind of where we hone in on the programs. If it's somebody's in a lot of pain, they're obviously got a lot of medical stuff that we got to clear out first before we can push them out into intense functional rehab stuff. So we really take them in three parts. The first, there's three parts. The first is restore, the second is retrain, and the third is reinforce. So the first one, restore, is really for those who have pain or are injured. We have to get them out of pain. We have to decrease inflammation if there is any, and we kind of have to get them to a non-acute phase. And that's really the primary goal at that point. Once they get past that, we go into the restore, and that's where we really try and restore normal joint function, normal muscular function, and then we start working with the basic functional or rehab patterns, just to start retraining the body how to stabilize, how to move, and all the, really the entry-level things. And once they got that down, they can go into the reinforce phase, and that's where they're moving well, the joints are doing pretty good, the muscles are getting pretty healthy, and that's where we really kind of reinforce strong patterns and reinforce the strength they need for their sport, whatever it is. So everybody comes in and goes through our entire process, and then we kind of put them in what part of this phase are they in? Some people come and they're not injured. They're not injured. They just want to get better, be stronger. And so we don't have to do so much of that acute work. We just kind of start fixing movement patterns and then getting into the strength stuff as soon as we can. So it's worked well. That's kind of how we assess everybody. And it's always changing. I'm sure we'll come up with new things that we find are important during the assessment process. And we'll just keep changing it. Whatever we find helps us, fix all their parts, we'll do it. But that's kind of, it makes it easy for us to really keep a consistent assessment so we know where we are and we know how people are doing.
Great. Thanks for explaining that. And so, for example, for the endurance athletes that are coming in, what are some of the kind of commonalities that you see when folks are coming in the door from an endurance background?
We definitely, when we see a lot of endurance athletes, so actually sometimes I'm actually shocked at some of the movements that they're not really good at. Some of these high-end athletes who just crush it out there on the course, and then you have them do something simple in here, and they just fail. And it's interesting to see that they can perform at that high level and still have all these dysfunctions happening. But it's also, I always tell them, we find all these things, and I actually enjoy that because the more things that we find, the more we can actually improve them and make them better. But we see a lot of, just some key areas. We see a lot of just hip dysfunction, hip flexor dysfunction, and, that really throws off how the pelvis translates power everywhere. That for whatever reason, a lot of these athletes are sitting all day long and they go out there and hammer it out. So it's a lot of abuse to the body, but we just see, there's common injuries, which I'm sure you know about in endurance sports. People have their IT band, their knee pain, plantar fasciitis, all these things. But those are really just symptoms of a dysfunction at the end of the day. So, they come in with something and we really say, okay, that's great. We'll take a look at that, but we really got to figure out where are you dysfunctional? Because that's really the only way this is going to stay away and going to get you better. So, a lot of this translates back into pelvis and hip stuff because it's really the central portion of how you derive power. So that seems to be the commonality, and we all kind of do the same things and sit at work. Most people sit all day long, and that's where those chains just get really messed up and weak and poor positions.
Yeah, that's when you said that, it instantly resonated because I'd say that's something that is I've noticed as well, is that you boil it down to imbalances in the pelvis, and particularly from not using it basically because they're sitting.
Yeah.
So I mean, and there's this kind of this talk these days that what sitting is the new smoking, and in so many different ways, metabolically and structurally as well. And then people are going out and doing Ironmans. It's crazy,
Yeah.
Without doing the basic stuff to get their body together. So what would be so say in an ideal scenario, before somebody goes out and like messes their body up a bunch, it seems like before you even get started in the sport, like getting a bike fit, you go to Momentum, you kind of get checked out, and you get your body in shape so that you can train without injury and effectively. Seems like that would be a good strategy.
Yeah, well, and that ends up coming up a lot during, when we're working with people. It's like, they're so, you talk about, let's just look at triathletes. They're good about bike fit and getting the right shoes and getting the right this and dialing in on course nutrition and all these things. And you just kind of have to step back and say, well, you haven't even checked your body. I mean, that's the number one tool you're using. You can have the best bike on the planet and fit it perfectly, but if your hips are dysfunctional, I mean, forget about it. It's just not going to really matter. Or maybe you're actually fitting your bike to dysfunctional posture, So, it's very important, I think, even for people who don't have this glaring injury that's sidelining them. I mean, you can learn a lot just from a movement or just all the stuff we do, but, especially even just movement stuff and seeing where the dysfunctions lie and trying to do basic stuff just to correct those. And a lot of times it's easier than people think. I mean, there's a lot of very simple things you can do each day. It doesn't take a lot of time to correct your dysfunctions, and it'll just make you that much more powerful in your sport. So it's really a no-brainer if you kind of understand the reason behind it. But unfortunately, I think many people are only driven to places like ours when they're hurt and sidelined. But hopefully we can change that and start getting people optimize their body as well as their bike and their shoes and all that stuff.
Right. I think that's one of the, if I had a lofty goal for part of this conversation, it would be that, that, and not only that, but, and I'm sure you've seen this as well, that sometimes athletes who've been out in the field for a number of years, maybe in different sports or whatever, and they're coming in with, like you said, symptom-based problems that maybe have their root in some structural challenge. But they're compounded. So, for example, the older athlete with, compressed discs and ossifications and, really, range of motion severely compromised, and they're coming in for back pain or something like that. And, I mean, and personally, as a side note, I'm not a very fast triathlete, but my goal is to someday race in Kona. And my only hope for that is that once I get to the 55 to 59 age group, when everybody's injured out, I'll still be there. And so then hopefully I'll be fast enough at that point. But yeah, I mean, it's huge. After, age 50, people start really aging out. They say aging out, but they're really injuring out of the sport. And, and longevity is like, I mean, that's what this is, in my mind, that's what this is like the prime reason why you'd want to go is for longevity in terms of athletic ability and all that.
And that's huge in any sport. I mean, longevity is really the key. But again, I think people they don't think about that until that's in question and they have to sit on the sideline. So I agree with you. I mean, that would be ideal if people would kind of use all of these experts as a way to not only get better, but just do it longer and not sit on the sidelines.
For sure. So let's talk a little bit about ART because I've actually never experienced it. I'm in soft tissue as well, but right. ART, you talk about ART, and I've seen this as well. It's the gold standard of care for athletes in particular. Why is that? What is it about ART that makes it special, and why do you consider it the gold standard of care?
Well, I think a number of reasons. I think, well, first of all, it's been around for a long time. I know it's just starting to get a lot more popular, but I think in mid-'80s is when Leahy created ART. So it's been around a long time. He's kind of been embedded in the Ironman world for a while. So it started off in the sporting world. So, most of the general public didn't know about it, but I think probably it's been around so long, I think there's probably over 600 protocols at this point. So it's very specific to the tissue you want to address. So whatever muscle or ligament or tendon or even nerve in the body, it's very specific to what you're treating, which is important not only for treatment aspect, but also diagnosis. You can really get in there, and so the treatment's partly diagnostic as well. You're trying to see if what you're doing is having an effect, what you feel as a practitioner. And it's constantly changing. It's constantly adding things and improving things and different ways to treat stuff. And I think that it's getting so widespread, and they've seen so many different athletes from different realms that it's really allowed it to morph into something that's, become very efficient. And it's an aggressive therapy. It's definitely, but I think that's why people like it. It's aggressive and it works quickly. It's, you notice changes. You should notice changes each treatment. And so I think it's just kind of over the years built into something that's, become a very precise way to not only diagnose but treat. So there's lots of stuff out there. I mean, don't get me wrong, it's not the end all be all. There's lots of stuff, that does wonders, and they all have their place, I believe. But I just found ART to be really useful. I know of a lot of people that have benefited from it. Before I went to chiro school, I lived in Canada for a while, and all the chiros there do it. I mean, ART is like commonplace there. It's a little different here. They're much more, 10 years ago, all the chiros did ART. You were kind of weird if you didn't. So I think we're kind of catching up to that, and I think ART is getting a little bit bigger, but, it's been around a while, and I think it's just that so many athletes have benefited from it. They've had the fortune to keep getting bigger and morphing and changing, and, it works good. I mean, that's all I can say. I don't know.
What are the so that kind of begs the question in my mind, like what if you were going to describe it to somebody, how would you describe it? Like the process?
Yeah, it's hard to explain, but I'll do my best. It's basically the goal is to you're trying to affect the health of the soft tissue, let's say. So we look for scar tissue and muscle adhesions that basically make a muscle tighter and dysfunctional, can compress nerves, can do all sorts of stuff. But we basically look for these adhesions, and we basically apply tension to these adhesions and then put the body through whatever tissue we're on. We put that tissue through its range of motion so we can effectively try and break up that tissue to restore new healthy tissue. And the treatment itself actually starts the inflammatory response of the body to that specific area to get the body to heal it. You break it up. It's like working out. You tear a muscle up and your body goes and heals it and makes it bigger. This basically is a very precise way to break up unhealthy tissue, create the inflammatory response so the body can go heal it and lay down healthy tissue. And in the process, you're also affecting the neurological system, the functional patterns, because you are putting the athlete through functional movements while you're treating them. So there's a dual aspect to it, which I really like, because I don't think he talks a lot about how it affects the functional nervous system part of it, but I find that to be a big part of it. So it's really good, and there's so many protocols because every muscle has a different function. So you're also getting diagnostic information while you're treating, because you can reproduce symptoms with the treatment that the patient has. You can find all sorts of things within there. So that's kind of it in a nutshell. It's like it's hard to explain, and once you go through it, all my patients, as soon as they experience it, it makes sense to them. They can tell what's happening. They can tell it's an effective part of the body, and they can see how that movement's been restricted by the tissue around. So, that's kind of the best way I can summarize it.
Sure. So how would a person know if they need ART? Like, when is it, or how do you determine if they could benefit from it? And is there any reason why they would be not beneficial for somebody?
Yeah, well, again, I think, I guess I say unfortunately, most people come here because they're hurt. They come in because they got all this pain. So you can't really have pain unless something's damaged. So that kind of lends itself right away to ART because there's obviously tissue damage if there's pain. So, you know, basically after we go through all the testing, we look and see. And part of my testing, to be honest with you, when I'm doing my chiro exam, sometimes I'm like, you know what, I'm not getting a lot of positive testing. I need to get in there and do a couple protocols and see what I feel. And that will actually tell me more than an orthopedic test. Because I can get in there and actually feel the tissue, know what it's supposed to feel like, and feels what there does. So if it's somebody who doesn't have any pain, let's say Dave's putting him through a movement assessment, he finds something that he just can't get to release or change for whatever reason with all of his protocols. You know, sometimes he'll come to me and say, hey, can we loosen up some of this tissue or see if the fascia is adhesed? Can you try and break it up or open up their hips? And that'll lead me to go in there and start feeling more exploratory and see what I feel and just open things up. It's really good at improving range of motion, you know, so if someone's got a tight hip and it's not necessarily adhesions everywhere, but the muscles are really tight, you know, doing some passes and opening up their hip, a lot of times you can increase range of motion pretty significantly in a short period of time. So, you know, I guess any contraindications to it, you know, you definitely can't work over contusions or infections. You don't want to be spreading that stuff. Someone's got severe swelling. You don't want to work right on top of that because you don't want to inflame the inflammatory response any more than it already is. Another instance where I kind of tread lightly is someone who comes in who's had partial or full shoulder dislocation, you know, because they're so loose already and their body's trying to tighten it back up. If I go in there and loosen up all that tissue even more, it just puts that at a more unstable position. So if somebody's talking about a significant instability in an area, I'll go somewhere else and try and loosen up somewhere else so that that area can stabilize. So
yeah, and I think you bring up a key point there, and that's that I've not heard a lot, but that I've also recognized is that oftentimes, you know, where you have an area of hypermobility that you absolutely, generally pretty much avoid that area, but that there's almost always a corresponding area that is lacking enough mobility, and there's almost like compensatory hypermobility for that, and that's where people get injured. So, you know, I explain it to people sometimes, and they kind of raise their eyebrows, but yeah, it's like ART is not going to tighten the tissue; it'll loosen it. But
it's going to
I guess that's what Dave does, right? He helps people tighten the tissue, and
yeah. I mean, he's really good at fixing functional patterns. Like if he finds a pattern that's off, I mean, he's got a million things in his head that he just kind of rattles off and he just fixes it. I mean, he's really good at changing patterns. But sometimes if the tissue is knotted up or the fascia is adhesed, you got to get in there. You know, you got to get after it and open it up. So, you know, again, I mean, you're right. I mean, if there's an instability somewhere, it's usually because something else is going haywire. So you got to go look at that and then stabilize that joint. You know, that's where Dave comes in. It's like, you know, we got to stabilize this, and so he can do a billion things for that. So, I mean, as you know, as a rolfer, I mean, the body is an intricate system of just integrated everything, you know, so you got to look at it all and stop looking at pain areas, just where the pain is.
So, yeah, and that's key because I think that, you know, maybe something that's for listeners out there, one of the gems that I call one of the gems that we've, you know, talked about today is that what you think is hurting is not necessarily where the problem is, and that's kind of what Dr. DiSaia was just explaining. And by the way, Dave's like an encyclopedia, so I can't wait to talk to him because he's got some really interesting things.
Yeah, he's amazing.
Yeah, you guys are lucky to have each other. So,
I trust me, I know. I mean, I'm so fortunate to have him here. He blows people away when they come in here. So we make a good team. It's fun. I mean, because I don't know everything, and he's way better at that than I am now. So I don't even try and do it. I let him do it. He blows me away. So
that's the idea behind the team, right? So. So okay, so I saw something in your literature about lack of proper oxygenation of the tissues, And can you talk a little bit about that and how, like what the problem is, where you see it, what situations you see it, and then how you use ART to resolve that? Because I think that that'd be kind of a big one, especially for endurance athletes.
Yeah, well, I mean, yeah, you're right. You're definitely right. I mean, basically, that comes down to you can have a lack of proper oxygenation basically to the muscles, for a couple of reasons. You have too much, it's kind of a cycle too. They kind of feed off each other. So if you have too much pressure applied to a muscle, from compression or whatever it may be, it reduces the blood flow to the area, which it in effect reduces oxygenation. You get less oxygen there. So, what happens then is that tissue becomes a bit fibrotic because it doesn't have all the blood flow it needs to stay healthy and the oxygen needs to stay healthy. So it's this cycle where you get this fibrotic tissue, which further reduces blood flow and oxygen flow because the tissue's not healthy and normal. So ART, you're basically breaking up that fibrous tissue, starting the inflammatory response, getting all the blood there, which brings all the oxygen. So that's one of the things it does really well. Now, for endurance athletes, and I guess compression can become from lots of stuff. You compress a muscle or you sit on a muscle all day long. You're just compressing it. Blood flow gets reduced, all these things. But endurance athletes need, the more oxygen they get to their muscles, the better, because they got to use them for long periods of time. So, let's say you have a muscle with 25% of it is fibrotic and scarred up, and you're losing 25% of the capacity of that muscle. And you need 100%. You need to have as much possibility of oxygen and function of that tissue as you can over long periods of time. So, yeah, it's a cycle. Leahy calls it the repetitive or the cumulative injury cycle. And it's kind of these things where they all feed off each other. Once they start, it starts this domino effect. And so you just got to get in and, again, that's one of the things ART does is it not only breaks up that fibrotic tissue to get healthier tissue, but it starts the inflammatory response, which immediately brings blood flow. That's one of the reasons you can't crush the tissue too much. You sit there and work on that thing for forever. You're going to damage it because you're just ripping it up. So, it's definitely, that's obviously a big thing when you talk about for triathletes. It's all about, getting as much use out of a muscle as you can because you got to do it for 10 hours or whatever it may be.
For sure. So, so that actually brings up another thought, which is that, as athletes age, they tend to get stiff and to coin a word that you were using, fibrotic in their musculature, losing flexibility and then performance with that. Have you had pretty good results with older athletes getting them to move better and getting better performance out of their bodies?
Yeah, I think you're always, the biggest thing when you're talking about older athletes, you can't change structural stuff, right? So you always got a piece of the pie that you can't change. So if you've got, bony growths off their hips and you got all these sort of changes that are happening interiorly, you can't change that, but you can always make improvements. So, somebody who's, an older athlete, they know they have all sorts of crazy arthritis and somewhere, I always tell them, I know I can help you. I know we can get this better. It's probably not going to be 100% because of all the stuff you got going on in there, but, tissue's tissue. You can change it. The only thing that changes with the elder, I think, is their recovery times slow down. You can't work them as aggressively sometimes. But yeah, you can definitely make changes. That's for sure.
So let's shift gears a little bit. People are coming in with, say, muscular and connective tissue injuries. That's affecting their health in a variety of ways. Some because of this structural challenges that people come in, they're going to have some, maybe some metabolic effects and other things going on. How do you use, I noticed you're also using nutrition. How do you use nutrition? What would be some general recommendations for, say, a nutritional protocol to aid the healing process of somebody who's going through your program?
Yeah, that's a good question, and that obviously varies a bit. But I think primarily, definitely, the best course of action is always whole food. It's what's their diet. That's the best way to get all the things you need. So, the general recommendation in that, you want to decrease the amount of sugars they have in their body. Aside from, I'm not talking about in-course stuff where that's important, when you're training, just eating healthy foods. That's number one. So to make sure that they're doing that, and if they're not, we make recommendations as far as, let's not have fast food every day. Because that's impeding your training, your body's ability to get better. And it's really all about recovery, in my opinion. That's really the crux of everything. It's how quickly you recover. That just makes you train better. It makes you not get hurt. So nutrition plays a huge, huge part of that. So, if we're talking about somebody who, and a lot of our triathletes eat well because they're obviously into being healthy. I'm kind of a guy who I kind of stay away. If you're eating healthy, multis are kind of not really important. I think you can get a lot of those from diet. It doesn't hurt, but I think for generals, I think there's a few supplements or I guess components that I like to make sure they're getting. I think omega-3s are important for a variety of reasons. Avoiding inflammation, having a healthy nervous system. So that's pretty one which I think we can be pretty safe in recommending for people. I think minerals are huge for triathletes, endurance, because they just get burnt so easily. They're out there training all day long and sweating, and minerals are really the cofactors in almost every reaction in the body. So a good mineral complex is, I think, very important. Again, you can get a lot of those from foods, but that's a whole other conversation about the depletion of nutrition and food and all that stuff. But minerals are a big one. And I like B complexes a lot. I think one of the things with especially long distance endurance athletes is, obviously overtraining is a concern, making sure that the neurological system isn't being fried. And so B complex are really good for the nervous system and for energy and for all sorts of things. But those are kind of my mainstays. Everybody's got a little bit of different things they may need. If their digestion's not where it needs to be, and they're not processing foods, probiotics are awesome just to keep, so you can use everything you put in your body and not just pee it right out or, waste it. And then it just depends person by person. Unfortunately, a lot of people are on medications nowadays, which really throws off nutrition. And so you got to really key in on, okay, well, what's that medication doing to your body and what are the side effects? And, what do we need to now add on top of that to make sure you're getting all the things you're needing? Because a lot of these medications just eat away at certain things in your body. They're just so harsh. So that's where it really becomes subjective, athlete by athlete.
Right. Just to throw an example out there, statins are one of those really big ones.
Oh yeah.
Especially for endurance athletes, because you're just it's ruining your energy production, your muscular, recovery, all kinds of stuff. It's just crazy.
That's where we have our CoQ10s. Yeah.
Right, exactly. So aside from my 800 tablet bottles of minerals that I keep in my house, and I'm sharing that with everybody because I take a lot. They get the giant bottles, but and they're great for so many things. But it seems that when I talk to athletes about supplementation, most of them are open to it, but some of them are wary of that, and rightfully so. It's kind of a loaded issue, where it intersects with competitive athletics. How do you deal with that? What are your thoughts on that subject, and what's been your experience with that?
Well, I think that's obviously, especially if you're talking about people who are professional or competing at a high level, and I think that's the big. I guess it comes down to this. I think that there's obviously lots of things out there that can just obviously if they're illegal, but there's lots of things out there that can just improve your performance kind of from a false level. And I think we've all heard about these things a million times in the press. Obviously I'm not into those. I don't think that's a good way to go about it, but I think nutritional supplementation, especially, you're talking about somebody who's working all day, training all day, has got families, got stress, all these things, and then you talk about our foods and, how depleted our soils are, and a lot of this stuff's got pesticides, all these things. I think supplementation is great. I don't see any reason not to. Because again, for me, it's all about recovery. It's one thing to go out there and train and have a great training day, but if you can't recover from that, then it's kind of pointless, because you're going to go out to the next session and just destroy yourself and get worse. So, I think it's an important piece of it. Especially if you're talking about competing at high levels, because then you're talking about little minute amounts of time that you got to make up. So, and that may be the difference between you recovering that much better each night. So I think it's an important piece for sure. I don't think people should be really afraid of it, especially if somebody's guiding you on that, who knows what they're doing. There's lots of stuff out there now, and I shouldn't go pick up anything, because you never know what's in that. And maybe there's something in there that's banned and they don't even know it. So, but I think it's a very, very important part. Any triathlete will tell you that on-course nutrition is huge. That's basically supplementation is what it is. You're supplementing for your training and for your events. And if you don't do that right, forget about it. You bonk, it's just, so it's really no different in my eyes. You're trying to optimize nutrition on course, which everybody knows is important. But a lot of people don't think about off-course nutrition. You're only as good as you recover, and half the battle's getting to the race. And if you don't get the race healthy, then, you're kind of shooting yourself in the foot. So I can understand the trepidation and taking lots of, and again, I'm not one to say, let's take 40 different supplements, but if you key in on the right ones for you and what is important for your training and your body and your health conditions, then I think it's a very important piece.
Yeah, and I think you hit on a pretty important point there, which is that it's the time off the course that's almost more important to prepare your body to be on the course, whether you're training or racing, and that even the top competitive triathletes who train for huge volumes every week, the majority of their time is spent not training. They're sleeping, or they're resting, or they're eating, or whatever. They're not training. So the rest of the time, they do train a lot, but that the rest of the time they're essentially recovering. And and for the kind of like your average shade tree athlete out there, they aren't recovering as much as, say, the pros. If you've got a job and you've got a family and maybe a business, and you're trying to run all that and train, you're under significant stress when you're outside of that training or racing window, and that's going to be affecting your recovery. So,
big time.
So you want to be, that's when, like you said, nutrition and the supplementation becomes even more critical. In my mind. So,
I agree with you. Yeah, 100%.
So tell me a little bit now about some of the results you see, because I'm intrigued by your program, and what are some of the kind of things that you have seen over the time that you've had the full Momentum program and gone through and worked that through with people and athletes and such?
Yeah, I think the biggest thing, once we started narrowing down this kind of process, is that I think, most people come in, again, unfortunately, with an injury, but they end up leaving performing at higher levels than they did before the injury, because in the process of this all, we've fixed 10 other things that are impeding, either causing their injury or impeding their training. So I think, that's the biggest thing. I was always pretty good at getting people, to overcome an injury and get them healthier and back out there, but we really started seeing a jump in performances and people increasing times or whatever their sport is, really increasing their ability to perform that sport. And being able to measure that, and that only comes when you, again, fix the back end, which is the rehab functional part, and not just getting a muscle strong, but actually fixing the function of the entire body. So that's the fun part. I mean, we always have people say that, I mean, I couldn't do this before I was injured. I mean, this is crazy. And in the process, we find all sorts of little things that they didn't even come in for. You know, they come in for whatever, their foot, and then all of a sudden, you know, their shoulders working better and their swim times are, you know, so it's fun to just see this cascade of improvements in their lives that happen just because, you know, all we're doing is making the body work like it's supposed to. That's really all we're doing. The body's pretty phenomenal, can heal itself and do all kinds of crazy stuff if you just kind of put it back to homeostasis and make it do what it's supposed to. So, I mean, that's been the biggest thing, seeing that jump and how people's, not only day-to-day lives, but their performance changes.
Yeah, that's huge. What you say about getting the body back to a place where it can right itself again is that's so, you know, people, when I mention to people, because that's kind of, it's funny that you mention that, because I mean, I don't think that's uncommon amongst seasoned practitioners really to see that over time. But when I mention it to people, you know, it gets kind of, oftentimes it just kind of breezes in and out of the other, you know, in one ear, out of the other. But to grasp the profundity of that is to accept that the body is incredibly powerful and versatile machine that has all the capabilities that we need. But
exactly.
You know, sometimes we just get in a little pit and we need some help out. And yeah, so I think it's totally awesome what you're doing. So what you know, how can people get involved in what you're doing? How can they do you do seminars? They come in. What's the best way for people to get involved in your programs?
Yeah, I mean, I'm not doing any seminars myself. We have a lot of seminars that we actually hold here for various things that we like. It's just how you came here. But yeah, I mean, we people can go to our website, which is momentumsportstherapy.com. We have a newsletter somewhere on that homepage you can sign up for and kind of get updates of what we're doing and different clinics we have here and all sorts of stuff. But, you know, we always, you know, my biggest thing is, like you said, it's just trying to educate people on what we do and how important it is to just making the body function like it's supposed to. It's really, when you break it down to that, it's not rocket science. It's just we're trying to make the body be as awesome as it is. That's it. So we always do here, you know, we always do a free consult for people. They can come anytime, and I'll sit and consult, see if it's something that we can handle, see if it's something that, you know, I can do or we need to refer them out, and then kind of explain the process and what we do. Most people, as soon as they hear it and I can explain it to them, they're like, wow, that makes a ton of sense. And it's easy. It doesn't cost them any money. They come in and we explain it to them. If they don't like it, that's fine. But at least it gives us an opportunity to explain what we do. Most people we got to put them through the process, and then they can, and from that point, we just kind of lay it out for them and say, look, this is all the stuff we found. This is how we can help you. And this is what we suggest. So, you know, that's my biggest suggestion is just have people come in and check us out. I mean, that's it. I mean, they can follow us online and do all that sort of stuff. But when it comes down to it, you got to experience. I mean, you'll never understand it reading our website. I mean, once you go through it, as you know, as a practitioner, once they go through it, it makes a lot of sense. And, you know, you don't have to do much more than that. So that's the biggest thing. You know, we always have events here, so they can go on our newsletter and we can keep them updated with that stuff. Yeah, for now, that's kind of the best way they can understand all about us.
Awesome. We'll have links and phone numbers and all that go out with the recording to folks. So definitely take advantage. This is one of those kind of undiscovered gems of Orange County. If you're in the Orange County area, or even if you're coming to visit here, check out Momentum Sports. It's a neat facility. You're going to love Dr. DiSaia and Dave and the rest of the crew. But I want to thank you for taking the time to do this today, Dr. DiSaia. I appreciate your time. And again, it's like having these conversations hopefully will give some people a little more insight into how they can you know, improve and address some of the challenges they're facing and all that, because, you know, the ultimate goal is to get people out there and enjoying themselves and having fun. But but as you go along, these things pop up, and to get a little deeper into the sport is to get, I guess, to really kind of delve into your own body and start to figure these problems out. So thanks for helping us do that.
Well, yeah, thanks for having me.
Sure thing. So this is Manny Aragon. I'm signing out for today, and I just want to thank you guys for joining us for this segment of the 2014 Endurance Summit with panelist Dr. Vince DiSaia. Dr. Vince, thanks again, and look forward to seeing you guys on the next episode. All the best.